Degenerative diseases are those that are characterized by progressive loss of neurons. And typically, we don't know the cause, but in a few cases, we do know the cause. So I believe we went through some of the terminology. So we said malacia was softening of the tissue in the CNS, while poliomalacia was softening of the gray matter, and leukomalacia was softening of the white matter. So there are two main diseases that we are going to focus on in terms of gray versus white matter. The first one is polioencephalomalacia. And in this disease, you have necrosis or softening in the cerebral cortex or the gray matter. So this is a cross-section of a bovine with polioencephalomalacia. And so the white matter is intact, but the gray matter has what I consider sort of a glistening, sort of bright appearance to it. And polioencephalomalacia is easier to diagnose hands-on, obviously, because you can tell that it's much softer than normal. The cause is thiamine deficiency or depletion. The arrow is moving by itself. Okay. So what do we know about thiamine in cattle, especially? So brachyfern is another cause of polioencephalomalacia indirectly. So brachyfern causes depletion of thiamine, and then the gross appearance or the gross lesion will be a softening of the gray matter, also known as polioencephalomalacia. So what would be your morphologic diagnosis for this picture? Yes, severe and diffuse polioencephalomalacia. There's no, let's say, necrotic, all of it. Because polioencephalomalacia gives you a definition of what's going on, which is polio, meaning the gray matter, and encephalomalacia, meaning softening of that area. So it's important to know the cause and and also where the lesion lies. And this is a closer sort of magnification of the gross image. And again, white matter, gray matter, or cortex of the cerebrum has a softened texture, but it looks like it's shiny and a little more glistening than normal. So that's polioencephalomalacia. So I can give you a picture like this and ask you for the etiology, ask you for the morphologic diagnosis. One of the interesting things about polioencephalomalacia, there's words we're probably under here, is that we can use on the gross or on the necropsy floor. So as you can see from the quiz, it's important to know when and where you use things to help with your diagnosis. So if I say gross or on the necropsy floor, this is something that you can see with your naked eye. So with polioencephalomalacia, when you apply ultraviolet light, it actually causes illumination of the areas of necrosis. So illumination of the gray matter. And so this is the cross-section of a cerebrum, and then we have the gray matter being a lot brighter than areas in the white matter. So it illuminates that. So that's a very helpful tool to use when you're just looking at the animal grossly. So that was polioencephalomalacia, and then leukoencephalomalacia is obviously softening of the white matter. And this is associated with the consumption of moldy corn. So moldy, also known as, I don't know why this is doing this. Yes, ma'am.
So if you have to differentiate the polio encephalomyelitis with like salt poisoning and lead, that's why you would use the stain, because all three of them kind of cause laminar necrosis.
So you would look at not only the gross appearance, because all three of them will cause that. All will cause the UV light to illuminate the areas of necrosis. It doesn't matter the etiology, but it does matter other things. So for instance, for salt poisoning, we'll see eosinophils associated with it. Lead poisoning, we may see other things. We may talk about the bones. It depends on the age of the animal. So there are other clinical aspects of it we'll look at. But that's a good question. It's hard to differentiate the three of them, and we'll kind of go forward with that. So it's also known as moldy corn toxicosis, and the corn is contaminated with the fungus Fusarium maniliforme, and that's important to know. So it's not just they eat corn that's old and whatever, it has to be contaminated with this fungus. And then the fungus, and then the toxin that's produced is fumonsin B1. So it's important to know the fungus that causes the leukoencephalomalacia, the toxin that's produced. Now, with this disease, you see typical CNS signs. You may see blindness, you may see ataxia, that, again, it's non-specific. But what's important is that when you look at the sections of the brain, instead of the gray matter being affected, it's going to be the white matter that's affected. So this is a cross-section of a cerebrum from equine with leukoencephalomalacia. So we talked earlier about when it was polioencephalomalacia, how the gray matter had that shiny appearance. Now if you look at the white matter in this case, it has more of a sparkled or bright shiny appearance to it. There's even some areas that are a lot more prominent in terms of the white appearance, but the main thing I want you to focus on is the level of sort of brightness or shininess that we see with necrosis. So gray matter will have more of a brighter sort of edematous sort of appearance to it, with polioencephalomalacia, while leukoencephalomalacia is predominantly the white matter. Okay, so just an introduction. I'm sure Dr. Ogden will talk to you, or I've already talked to you about some of these toxins that can affect the CNS sign or CNS system. And the three that we're going to look at is yellow star thistle, lead toxicosis, and salt poisoning. So yellow star thistle is also known as Centuria saltialis. That means I don't even use that ever. But so what is characteristic about this plant is its appearance. So it has a bright yellow flower and has multiple thorns projecting from the base. So it's called yellow star, yellow coloring, and has like a star appearance at the base. Now, animals typically do not eat this plant for obvious reasons, because there are huge thorns on there. So these are the animals, and this is going to be predominantly horses that are going to consume this when they have nothing else to eat. They are starved, they have no grass available and no other feed to consume, so they eat these. And when they do, the classic clinical presentation is persistent chewing. So sort of, movement of the mouth, and then they have difficulty with prehending or consuming food and water. So that leads to massive emaciation and eventually starvation and death. And what do we see grossly? We see softening or melastic lesions in two main areas: the globus pallidus and the substantia nigra. Now, typically I don't ask you to remember certain areas, but this is important to know where we see, bless you, softening of the brain with these animals. So globus pallidus and substantia nigra. So I'm sure everybody remembers where those parts in the brain are, right? Let's look at the normal. So this is a cross section of a cerebrum. You have your cerebellum at the base down here, and brainstem even below. And the globus pallidus is right here. It's right below the area of the basal ganglia, and sort of next to the thalamus. And the substantia nigra is sort of at the point of the brainstem. For whatever reason, the toxins that are produced by this plant causes necrosis and softening of those two focal areas. So if you take a cross section of the brain and you look, you can see that white texture or appearance for those two areas. This is an H&E section of low magnification of the cerebrum, and the bright pink is associated with normal brain structure, and the washed out or pale areas with cracks and fissures are the areas of necrosis or malacia. So this is, obviously I can't give you just this picture because you can't really tell what part of the brain this is. But this is the typical H&E section we see with yellow star thistle in terms of causing focal areas of necrosis. So substantia nigra and what's the other one? Globus pallidus. The second toxin, we talked about it a little bit when we looked at the bone, and that's lead toxicosis. So it usually leads to death when we talk about acute lead toxicosis, which is pretty rare, and within 12 to 24 hours of consumption. The difference occurs with the age. So with calves, you see muscle tremors, staggers, and then with adult cows, you see head pressing and blindness. So it's important to know that, again, these CNS signs may be non-specific, but for young animals, we see one clinical presentation, while with the adult animals, we see something a little different. Just like Christina mentioned, with lead tox, yes?
I just wanted to understand, so like if I were to be out on like in someone's production area and see a cow and her calf, wouldn't convulsions look similar for both of them? Like how would you differentiate these?
The convulsions will look similar, but one thing you see that you don't see in the babies is that typical head pressing and the blindness. We don't see that with the young ones. So the young ones, you just have tremors and convulsions. But for adults, so instead of saying, one has tremors, one has staggers, which you can tell that difference. We know that the head pressing and the blindness, we see that with the adult animals. And then you would add your microscopic lesions. So most likely these animals will be euthanized or die from the disease. And microscopically, you see laminar cortical necrosis, which is also known as polioencephalomalacia. So the laminar cortical necrosis is another term for softening of the gray matter. So what are these? Okay, good. I'm like, you don't know these? So this is another way that you can get lead toxicosis, but that's an unusual. It's usually due consumption. So how would they get lead? Where would the lead come from? Paint. So they could be licking a wall in an old building or old area that has been a fence has been painted a long time ago. What else can you get lead toxicosis from? Getting shot. Good. Okay. What else? If they're in an area with a lot of trash, old what? Batteries. So batteries that people just leave. These animals can consume some of that. So also in salt poisoning, so that's the third one. We see that in sheep and goats and also in pigs. And the cause is when they're prevented from having a free access to water of low salt content. So when would that happen? Besides the owner just forgetting to give them water, what other condition can we have low water availability? And what?
Drought.
Drought. And what else? Frozen. So winter, when these animals are outside, or even if they're inside and there's poor heating of the environment, we can have freezing of water and then low access to free access of water with low salt content. So with pigs, we have blindness, deafness, head pressing, and convulsions. And it can start from one area of the body and sort of progress to the rest of the body. Bless you. They may walk backwards, they may have epistotonus, and they may have what we call like dog sitting or sitting down as well. Microscopically, this is pathognomonic. So if you see 1 + 2, bless you, it is equal to saying we know for sure that this animal has salt toxicosis. The first thing is an eosinophil infiltrate within the meninges and the brain. So we have eosinophilic meningoencephalitis, and softening characterizes the disease. So eosinophilic meningoencephalitis and laminar cortical necrosis are the two things that are pathognomonic for salt toxicosis. So eosinophils in general are unusual unless we think like what is happening? We have parasitic infection, but with salt toxicity, you see a combination of a lot of eosinophils within the brain and spinal cord and laminar cortical necrosis. So this is a high magnification H&E. We're looking at a blood vessel in the corner, in the right corner. You see the blood, the red blood cells. And cuffing that blood vessel is a moderate infiltrate of eosinophils. So we have an eosinophilic infiltrate, it could be cuffing blood vessels, and it could also be in the meninges. And then we have a cross section, which is a gross image, and we have polioencephalomalacia. So if I give you a picture similar to this, it would be difficult to tell if this is salt poisoning, lead toxicosis, or polioencephalomalacia due to thiamine deficiency. You really cannot differentiate the three, even if you add, as Christina mentioned, the UV light, you would have to do further diagnostics. Obviously, when you add your clinical presentation, your history, it will help you narrow down between the three. So again, if we look at it on H&E, we see the acute laminar necrosis or the gray matter necrosis. So 3 causes of laminar cortical necrosis or softening of the gray matter is polioencephalomalacia due to thiamine deficiency, lead toxicosis, and salt toxicosis. So those are your top differentials for that. Yes?
So, is there a different context when you use polioencephalomalacia versus laminar necrosis?
No, you can use those terms interchangeably. Sometimes when you say the term polioencephalomalacia, you could be talking about the disease itself with thiamine. So a lot of pathologists prefer to use the term laminar cortical necrosis because that's less specific. But they're used interchangeably in the literature. Any questions? So make sure that you're familiar with all those three diseases in terms of their similarity and how you can differentiate the two. The next two are, again, miscellaneous, and we won't spend a lot of time on them. So the first one, you should have re-looking at this. You may have talked about this in anatomy, and it's neuritis of the cauda equina. And so what's important to know is how it presents clinically. So these horses typically present with tail paralysis and loss of sphincter tone. And it doesn't have to be horses, it can be other animals, but we typically associate it with an equine species. So when you have sphincter tone loss, usually you have loss of control of the urinary bladder and rectum. So what would we see with these animals? So tail paralysis and then what? Incontinence. So they're dribbling and they may lose, they're losing control of both their urinary bladder and the rectal sphincter. The lesions are confined primarily to the cauda equina, but can spread to those peripheral nerves as well. So it's a polyneuritis. I'm not going to give you this picture because one, it really is, it's not. So did you all dissect out the cauda equina in anatomy? Okay, so you're familiar with that. So what you'd see typically is thickening of the dura and the inflammation of the spinal nerves because you have compression in those areas. This is a dissected out cauda equina. This is like my nightmare in terms of necropsy because just horses in general have spinal cord injury. You know, we have to dissect out from the top of that animal all the way down to the cauda equina. So that's a long afternoon. So first we do the necropsy of the rest of the animal, and then we have to cut out the spinal cord, the vertebrae, and then dissect out all the spinal nerves. And then fix that whole spinal cord for about a week and a half before we can look at it microscopically. You just